In this video, I'm going to illustrate for you why ADHD is a myth and how what we are doing, and when I say we, I mean society as a whole, our educational systems, parents, teachers, in cooperation with psychiatry, medical doctors, and pharmaceutical companies really are engaging in a deep betrayal of mostly young boys, but also teenagers in this whole epidemic of ADHD diagnosis and drugging people with toxic, dangerous brain drugs. Few things in life are worse than child abuse. And when you give children dangerous, toxic brain drugs to treat a non existent disease, that's fraud. That's deception. That should be, in any civilized society, a crime against humanity. But in our current society, this is described as scientific, as care, as mental health, and as something which is supposed to be celebrated. So, what the hell is going on? Back in 1970, in the United States, 150,000 people were diagnosed with what then was called hyperkinetic reaction. In 1980, with the introduction of the DSM-3, where this was turned into a medical problem and began to be diagnosed as a neurodevelopmental disorder, where disorder implies an abnormality, a disease, and started to really get emphasized to be a so-called chemical imbalance in the brain. ADD, as it was called at the time in the United States, you had 500,000 people who were diagnosed, and these were kids at the time. In 2006, and it got voted in as ADHD in 1987. In 2006, in the United States, you had 6 million kids who were diagnosed with this fictitious disease. Today, in the United States, 13% of adolescents are being diagnosed with ADHD, and the majority of them are given brain drugs. In some southern states in the United States, 30% of boys are given a ADHD diagnosis before they turn 18 years old. Most of these are also drugged. The stimulant industry is a $10 billion a year industry. There's a lot of money there. If we move attention to my native Norway, where I live, we are one of the top countries in the world in diagnosing ADHD and drugging our children and our teenagers. So in 2000, we've diagnosed and drugged tens of thousands of kids in this small country, which has a bit more than 5 million people living in it. In 2018, ADHD drugs were sold for 350.8 million NOK, or Norwegian kroner, which was an increase in 88% just since 2010. So you may wonder, what on earth is going on? What is going on with this epidemic of diagnosis and drugging? And what are the medical basis behind this? What does the science show about the effect of stimulant brain drugs, psychoactive drugs? So in this video, I'm going to go deep and take you on a little guide to attempt to illuminate this, because I just think that what's going on is so tragic. It's just unforgivable what we are doing to young people. So let me start off by sharing one thing that may be going on in terms of why so many kids today seem to struggle with impulsivity and inattention and hyperactivity, which seem to be the three components of ADHD in a school setting. When I was, I live in the same house as I grew up in as a kid. My wife and I bought my childhood home back in 2009. And when I grew up in the area where I live in Norway, if I as a child went outside into the street, there were a lot of kids on bikes, on skateboards, playing things in the streets, climbing trees, stealing apples from neighbors. There was most of the time a lot of kids. You could just go outside and you could be sure to meet a lot of kids. Today, I have kids who are 5 and 10. If I walk outside, there's hardly any kids. Kids hardly have any free play anymore. They're not out playing on their own. They're either inside on their iPads playing video games, or being driven around by their parents to organized activities. Jonathan Haidt and Greg Lukianoff, in their book The Coddling of the American Mind, talked a lot about the current kind of mental health crisis of young people, how so many more young people today seem to be struggling with depressing and anxietizing and harming themselves and suicide attempts. And one of the factors that they point to in terms of this mental health crisis is that kids are being deprived of free play. If you look at the work of Jacques Ponxeep, the author of The Archaeology of Mind, he was a pioneer in the field of affective neuroscience. He wrote about rough and tumble play for kids, and he wrote about in experiments with rats, if you deprived rats of the opportunity to engage in rough and tumble play, they would get hyperactive and impulsive and inattentive. And there's quite a bit of research that shows that kids actually learn mainly through play. We need play to be able to develop our capacity to sustain focused attention. So I'll quote a couple of things here. The first one here is from Professor Joel Nigg, and he says, for children, aerobic exercise expands the growth of brain connections, the frontal cortex, and the brain chemicals that support self-regulation and executive functioning. There's quite a bit of research that supports what I'm saying about play here and kids. So for example, when kids get to play, that's how they develop the capacity to focus their attention in a sustained way over time. You learn to develop that capacity by engaging in activities that evoke curiosity and fascination in you. These days, where parents run the show and everything is about organized activities, a lot of kids are deprived of that very opportunity. The same thing also goes for what you could call intrinsic motivation. You have to be given the chance to discover what fascinates you, what engages you, what you want to do as an expression of what lives in you. When the environment is overly bureaucratized and structured by adults, it's very hard to find meaning when everything is laid out for you and you're essentially just doing what teachers and adults think you should be doing. There's a lot of other capacities too that play evokes, creativity, imagination, initiative, making up a game, learning to calibrate and negotiate, learning to persuade other kids to want to play the game you want to play, learning social norms, learning to take turns, learning about risk taking and your limitations, getting ostracized, learning to stand up for yourself, learning what you can do, learning to deal with ambiguous information. There's so much going on there with free play. Now, given that anyone who's done some reading upon affective neuroscience, if you read Panksy or you have any psychological insight, you know this, right? So then the question becomes, do schools function in such a way that kids, and especially young boys, are given the chance to play to their heart's content every day? No, they're not. Schools increasingly, and childhood itself functions as mini prisons with education being about standardized testing and having to sit still for a long period of time. This is not a school system designed for especially how young boys are designed to develop or work. What do? We punish children for being children. And when they don't pay attention in the way that we want, we invent a disease and we drug them, while claiming that we love our kids about everything else and that they're the most important thing in the world to us. There's something about that theory that just doesn't quite ring true. Now, let's look at the diagnostic criteria for ADHD, what it actually is. All it really is a list of behaviors. That's it. It's just a list of behaviors that sometimes occur simultaneously. And if the teacher and the psychiatrist, agree that the child's behavior matches up to this list to a sufficient degree, you get diagnosed with the neurodevelopmental disorder called ADHD, right? So here is it. This is childhood in itself being turned into a disease, right? So diagnostic criteria, I'm not going to read all of it, just going to give you a little bit. For attention deficit hyperactivity disorder, you have to have 6 or more of the following symptoms of, if you start with inattention. Inattention persisted for at least 6 months to a degree that is maladaptive and inconsistent with developmental level. Listen to this. So this is the inattention component. Often fails to give close attention to detail or makes careless mistakes in schoolwork, work, or other activities. Often has difficulty sustaining attention in tasks and play activities. Often does not seem to listen when spoken to directly. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort, such as schoolwork or homework. is often forgetful in daily activities. This is childhood, right? Hyperactivity, often fidgets with hands or feet, or squirms in seat. Often leaves seat in classroom or in other situations in which remaining seated is expected. Often runs about or climbs excessively in situations in which it is inappropriate. In adolescents or adults may be limited to subjective feelings of restlessness. Is often on the go or often acts as if driven by a motor. Often talks excessively. Final one, impulsivity. Often blurts out answers before questions have been completed. Often interrupts or intrudes on others. Now, some impairment from the symptoms is present in 2 or more settings. These are the types of criteria that are used to diagnose the disorder called ADHD. Now, kids who don't pay attention in school and who are a pain in the ass for their teachers have probably been a problem as long as there have been teachers, right? So what do we do with this, right? Do we, it's one thing to say, look, your son or your daughter behaves like this, and we got to tweak things a little. We got to work on his behaviors or his ability to focus or something like that to try to find out what's going on in this person's life. No, we don't do that. Do we organize things in such a way that kids get to play to their heart's content? No, we don't do that. Now, these behaviors tell you nothing about why the child is not really paying attention. So, for example, for me, I went to an American private school in Dubai as a kid. I was told I had ADD at the time. I was procrastinating. I was not paying attention. I was daydreaming a lot. There was another kid called Wilhelm, who was from Sweden, who had a special task to point out to me, Jürgen, stop daydreaming. Now, I don't think, but that doesn't necessarily tell you much, right? For me, I just didn't like school. I never did. I never found school engaging or meaningful at all. This was the case for me for all of my schooling. Schooling felt like, to me, a prison. I was relieved when I was able to get out of it. Now, thankfully, I wasn't drugged. But there's so many things that could contribute to a child or an adolescent not paying attention, right? So if we look away from the whole being deprived of play and kids spending so much time these days on their iPads, on their phones, with activities where the attention is multitasking and shifting every few seconds, it's not very conducive to how you have to pay attention in a classroom, right? What's going on in the person's home life? So, for example, scattered minds, as Gabor Mate has written about, can also be a response to trauma and to high levels of stress. Consider this. If you grow up in a family where your parents are very, very stressed, young kids need parents to soothe them. If that happens enough, you learn to self-soothe. If your parents can't do that for you, and you have a lot of stress and activity going on, one defense mechanism can be to tune out and to just have a very scattered brain or a very scattered way of attending. So what might be going on in that particular kid's home life, for example? a lot of young boys especially lack attention from their fathers. If you look in the States, for example, and more black kids are diagnosed with ADHD than white kids. People born later in the year have more occurrences of ADHD diagnosis than people born earlier in the year, right? So if you look at, for example, in the early 60s, for black families in the United States, about 75% of them grew up with a father. Today, only like 25% of young boys grew up with a father. It's so important to have a male figure, to have a present father. Some of these kids probably suffer from dad attention deficit syndrome. Other factors that could go into this. You might have a kid who's too bright for the curriculum, who's just bored out of his mind. You may have teachers who are incompetent, an essentially boring classroom setting. You may have, and especially for kids born later in the year, kids whose maturity levels are not quite up to par with what's being presented in the curriculum. You may have kids like I was. I don't think I was particularly either bright nor dull. I just did not find school engaging whatsoever. So people who just can't find any meaning in it, and who also have some kind of disagreeable personality tendencies, who like to object and are curious and like to explore things on their own terms. You may have kids who struggle to sleep. You may have a kid who has diabetes, or you may have someone who has a head injury, sports type concussions. There's probably other factors too. There's so many factors that might go into why someone is behaving in that particular way. But instead of individualizing that, what we've done is that we've invented this disease that we call ADHD. And it's being sold as a neurobiological or neurodevelopmental disorder. Disorder essentially means disease, or a syndrome, or a chemical imbalance in the brain, despite the fact that none of these ideas have not been proven. They have not been proven scientifically. They've tried for decades, but there really is no proof that there is a disease or a disorder or a chemical imbalance called ADHD. There is no biological test whatsoever to verify an ADHD diagnosis. So if you look at, for example, medicine, when you do a medical diagnosis, disease is supposed to mean abnormality, that you can demonstrate through laboratory testing the existence of some cell pathology or abnormality. So you would have some physical pathology found in X-ray, CAT scan, or MRI procedures, or some microscopic pathology found in slides, and or chemical pathology derived from blood tests or other bodily fluids. There's nothing like that. I'll repeat, there's no tests, there's no biological markers, there's no evidence at all. So this is, since there has been no demonstration of an abnormality in the brain, it is not a medical diagnosis. It is not a disorder. So when that is sold to young people and kids, and also adults, as if it was a legitimate, scientifically established disorder or disease, that's just fraud. It's just flat out deception. A bunch of behaviors is not a disease. You can't, based upon a cluster of behaviors, claim that someone has a disorder. Um, a you know, and the whole ADHD diagnosis is only about observable behaviors. There's nothing really about what's going on in the person's subjective life. But thoughts are not a disease. Feelings are not a disease. So why is this important? Well, if you start to diagnose disagreement or unwanted behaviors or ideas and feelings as diseases, then things get very political and very much about social control. You've really left what's supposed to be science and medicine behind. You know, even if a set of behaviors or a set of thoughts and feelings or experiences are painful, that in of itself is not evidence of a disorder or a disease. I'll give you the example of chronic pain, which is an area where I've done a lot of work. So what is known today is that most chronic pain is neuroplastic, meaning it's generated by the brain, and it's a false alarm. Now, the pain is real, but it's not due to pathology. It's generated by the brain. There's 44 regions of the brain involved in generating the experience of chronic pain. You can even on an fMRI see the difference between chronic pain and acute pain. They look different on scans, right? So you can say you have certain brain activation that corresponds with certain subjective experiences. That is true, but that is not evidence of a disease. Why is this important? Because sometimes when people have a headache, they may have an actual disease. They might have a brain tumor, for example, cancer, and the pain has to do with that. But they may also have intense pain in their head or in their stomach or somewhere else and have no disease at all. For example, young kids often have stomach pain, before going to school. Pain is real, but there's nothing wrong with the stomach. So, for example, one of the things that keeps chronic pain going is a fear-pain loop. It's the interpretation of benign sensory data as a threat that turns on the fear circuits and then generates the pain. There's a fear-pain loop. And a lot of what keeps it going is the interpretation that the pain has to mean that there's something physically wrong. That interpretation is a large piece of what keeps the pain going. So it's extremely important in the case of pain. Pain is pain, right? But it's extremely important to have valid medical tests to determine whether the person in pain actually has a disease going on or whether it is neuroplastic, because you want to deal with it quite differently. I'll give you another fun example. So, for example, a couple of 100 years ago, masturbation was evidence of the disease called masturbatory insanity. A couple of 100 years later, masturbation is a solution and considered part of a healthy sex life, right? So much science behind masturbatory insanity. Now, the behavior that you label masturbation, of course, exists. The disease called masturbatory insanity did not, just like with ADHD. The various behaviors that I just described from the diagnostic criteria, they exist, obviously. But the neurodevelopmental disorder or chemical imbalance or brain disease called ADHD does not. It's a myth. So, you know, you could do tons of scientific studies and show that people who masturbate a lot have different brain activity than people who don't masturbate. Sure, you might even find correlations with personality tendencies and that people who masturbate a lot and who are very sexual have certain regions of the brain that are more active than people who seem quite asexual. Sure, but none of this proves the existence of a disease. So of course, a person who's bored at school or not attentive or is impulsive, his brain activity might look slightly different. He may have a more active seeking circuit or whatever, but that in of itself is not evidence of a disease. So it's so important to separate the two. Also remember this, psychiatry has always functioned as a form of state-based social control. There really are two branches of psychiatry. You have the voluntary part of psychiatry, and then you have the involuntary part of psychiatry. And the problem is that even a voluntary psychiatric activity can very fast turn into a non-voluntary psychiatric activity. So as soon as someone is given a psychiatric diagnosis and they are deemed to be psychiatrically ill or medically ill, all of these diagnoses, by the way, are fraudulent because there's no medical testing behind any of it. But as soon as these people are diagnosed as medically ill, a psychiatrist then can way more likely force you, in conjunction with a school teacher, to drug your kid. And if you refuse to, child services can come and take your child away from you due to medical negligence. So I have in my practice over the years I've seen a handful of parents like this throughout the years who have been running away from child services because their child has gotten an ADHD diagnosis. They've been told to give the child Ritalin or Concerta or Dexedrine or whatever, and the child has had strong side effects and not wanted to do it. And they've taken their kids off the drug, and the school and the psychiatrist has forced them and threatened them with child services that if you don't do this, we'll take your kids away. So there are quite a few cases like that in Norway. The Norwegian child services are kind of notorious. Even the BBC has made a documentary about them, and they have several convictions against them in international courts for violating human rights. But I know this also to be the case in the United States and other countries as well, that parents who either because they don't believe in the idea of mental illness or because their child has had severe side effects from the drugs, who have refused to medicate the child, who have been forced to drug their own child, and also parents who have had their kids taken away from them by force. And all of this is made possible due to the fraud and the deception that it's a medical negligence to not go along with the forced drugging. So another objection here that a lot of people will bring in is, but so what if it hasn't been proven that there's such a thing as ADHD, as a neurodevelopmental disorder or chemical imbalance. The fact that the drugs work is evidence that this has a biological base, right? And then the question becomes, what are the effects of these drugs? By the way, there's no scientific support or test to validate a so-called chemical imbalance in the brain. The whole lack of serotonin theory for depression has been debunked a long time ago. Same with the idea that people with ADHD have too little dopamine in the brain, and that people with schizophrenia have too much dopamine in the brain. The science is not there, right? So anyone who's telling you that it is not being scientific. This is ideology. So let's look a little bit of the history here of stimulant drugs in this treatment. But by the way, and Joanna Moncrief has an excellent book called The Myth of the Chemical Cure that I really recommend if you want to look into this. She also has a YouTube talk called The Myth of the Chemical Cure. And the point she makes is that these drugs do not correct a chemical imbalance. They just chemically produce a different state. And sometimes people may prefer the chemical state that the drug supports. So the classic example would being someone who's socially anxious, and they take a couple of beers and a couple of shots, and now they feel more comfortable approaching someone socially. You might say that they like the effect, or they prefer the state that they're in after having a few drinks of alcohol. But of course, they were not suffering from a chemical imbalance where a lack of alcohol was the culprit. You know, the alcohol is not correcting a chemical imbalance. It's just producing a different state. Now, there's a lot of arguments that the drugs actually produce a chemical imbalance, actually produce the very chemical imbalances that they are intended to correct. These are psychoactive drugs, you know, where the user is subject to tolerance and withdrawal, and then a chemical imbalance gets created over time. So back in 1937, a guy called Charles Bradley, he was a medical director at what today is called the Bradley Hospital, noticed that a stimulant called Benzedrine caused kids to focus better and improve school performance. So today, methylphenidate is the stimulant most often prescribed to kids and was marketed in 1954 as Ritalin. Now let's see what let's see what some of the effects are. By the way, the long-term studies of using stimulants do not support either the decrease of ADHD symptoms, nor do they improve school or academic performance. So the long-term meta-studies show that people who use ADHD drugs do not benefit in any way, shape, or form as compared to a control group. They actually do slightly worse. So there's a very well-known MTA study that was orchestrated by the NIMH, and after 6 years, so after 14 months, there was some improvement in the ability to focus. That's one thing people seem to agree upon. There is a temporary advantage in being able to focus in the short term. So after 14 months, there was a slight increase in academic performance and an increase in the ability to focus. But after 36 months, there was no advantage whatsoever, and at 6 years there was like a deterioration, and after 8 years, it shows that there's no benefits to taking these drugs whatsoever. There's also a big Norwegian meta study that came out in 2018 by Henrik Vogt and Charlotte Lunde. It's published in the Norwegian Journal of Psychiatry. It looks at all of the studies since 1974. It concludes the exact same thing. There's no long-term benefit, either in the activity the ability to focus, or academic performance, or decrease of what's called ADHD symptoms. But still, this stuff gets prescribed, and it gets prescribed even though these are dangerous, toxic drugs. So let's look at some of the established side effects. So in the MTA study, 64% reported side effects. There was a Norwegian study where it showed that 65% of medical doctors did not ask their clients about side effects at all. So one side effect, the strongest one, is a suppression of height, growth suppression, and also a suppression of weight in young kids. So after 2 years on the MTA study, there was a 2 centimeter reduction of height and 2.7 kilograms. There's an increased risk of cocaine abuse as adults for kids who use ADHD medication. For example, here in Norway at the moment, teenagers and young adults use a lot more cocaine than they used to do. Now here's something from Peter Bregin's brain disabling treatments in psychiatry. So methylphenidate, amphetamine, and cocaine have very similar effects on the brain and body, except that cocaine is shorter acting with more initial punch, making it more dangerous than the others. In 2015 in Australia, there was a meth addiction crisis. And what they gave a lot of these people to tamper down their withdrawal symptoms was dextroamphetamine, which is what's given to kids, ADHD drugs. Adderall, another common ADHD drug, is also given to adults for meth addiction. There's plenty of anecdotal reports of adults, parents who abuse cocaine, who take their kids' ADHD drugs to tamper down their own withdrawal symptoms. It is kind of fascinating, given what I just quoted from Dr. Bregin, that at schools you have all these campaigns about not using speed, not using amphetamines, not using cocaine, say no to drugs. And at the same time, when kids are a pain in the ass and they don't comply with a rigid school system, we drug them with brain drugs that work on the body and the brain in a lot of the same way. That's scary to think about, especially given that there are so few long-term studies on these drugs. And we just don't know what effect it is. But imagine taking 5-year-olds, 6-year-olds, 7-year-olds and giving them these sorts of drugs. So here are a list of some of the established side effects. So you have the growth suppression, which is perhaps the most stable one. Well, you have that they are subject to abuse and addictions. They increase the chances of cocaine abuse when they become teenagers and adults. They create chemical imbalances in the brain. And they threaten cardiovascular functions. You know, it's well known that long-term cocaine use can contribute to heart disease. And of course, this doesn't happen often in kids, but there are quite a few reports of young kids dying of heart attacks and heart failure who have been on these drugs. They induce bipolar symptoms in about 10% of those who take the drugs. It encourages OCD-like behavior and tics. And when kids use stimulants, they sleep less. If there's something you don't want to do with kids and teenagers, it's to give them stimulants that make them sleep less. Sleep is so important for learning, concentration, attention, everything. If you have any doubt about that, read the excellent book Why We Sleep by Matthew Walker, and then come back and consider, wait a minute, these stimulants actually cause kids to sleep less. Like, what on earth are we doing to our kids? It can produce mania, anxiety, depression. Let's see here. Oh, and what was that? They also produce long-lasting atrophy of the brain. Those who use it for a long time tend to have lower IQ scores and higher mortality rates. And I read something here from Dr. Peter Breggin. This book is called Psychiatric Drug Withdrawal. I highly recommend this. This is on page 78. So I'm just going to quote Dr. Breggin because this is kind of important. For several decades, studies have shown that children diagnosed with ADHD and treated with stimulants suffer from atrophy of the brain. At the National Institutes of Health Consensus Development Conference on ADHD, Swanson and Castellanos, 1998, reviewed the available studies purporting to show biological basis of ADHD, including brain atrophy. My own presentation at the same conference concluded that the findings of atrophy in children diagnosed with ADHD and treated with stimulants are almost certainly measuring pathology caused by the psychostimulants. For more extensive review, see Breggin, 1999. Further confirmation came in the unpublished public discussion following Swanson's presentation, when neurologist Frederick Baumann Jr., author of the book ADHD Fraud, by the way, that I really recommend, asked Swanson if any of the studies in his review involved children without a history of drug treatment. Swanson could not name a single study based on untreated patients and offered the disingenuous explanation that untreated children diagnosed with ADHD are difficult to obtain in the United States. Think about that. Think about that. A recent 33-year follow-up of children originally diagnosed with ADHD continues the trend of blaming drug-induced atrophy of the brain on ADHD rather than on extensive exposure to psychiatric medication. Pro al. 2011 found widespread atrophy in the brain, including a reduction in mean global cortical thickness in grown adults, mean age 41. The authors relate the finding of brain shrinkage to adult ADHD, but in fact the grown adults had polydrug exposure to psychiatric drugs starting in childhood and continuing in adulthood, when most of them were given additional psychiatric diagnosis and no doubt additional psychiatric drugs. They also had lower IQ than the control group, and their death rate far exceeded that of the control group, 7.2% versus 2.8%. So it should come as no surprise that stimulant drugs cause brain damage. Numerous studies of stimulants in animals indicate that stimulant drugs are neurotoxic, causing long-lasting changes in neurotransmitter systems. Yeah, it's kind of scary. So, do we really love our kids above all else? Are we just too ignorant? Are we too obedient, too trusting in psychiatry and the state? Anyways, that's my in-depth video on the myth of ADHD and the betrayal of mostly young kids. I hope this has been thought-provoking to you. If you have any comments, please post them where you find the videos. And know that I see clients from all over the world online. So if you'd like to see if you and I could be a good match, you're welcome to send me an email at provocativehypnosis.com. All right, thanks for listening.